Nuffield Chichester Hospital is something which believes in giving a personalised care to the patients. They go beyond the patient ailments, they look after their social and other aspects of welfare apart from treating their medical illness. I think the patients get here one-to-one care, be it from consultant surgeon or the other allied medical staff, and all this makes the journey for the patient more enjoyable while they're going through this stressful and difficult period of time.
Orthopaedics offers quite a spectrum. So for me, it was all about changing individuals' lives in terms of their quality of life. There's an awful lot of chronic disease in orthopaedics, and you can make a real difference to patients' quality of life and outcome.
My special interests mainly are hips and knees, so I do all kinds of joint replacement surgeries for hip and knee, and also I treat the sports injuries, especially in and around the knee, and the redo surgeries when the hips and knees either get worn out over a period of time. But having been trained in them, it gives me a holistic approach to a joint, how to be doing it rightly the first time so that it lasts as long as possible.
We concentrate very much on making this a friendly, easy atmosphere for patients to experience. And it's not just the clinical staff, it's also the administrative staff who deal with all of the preparation that patients need before they come to an operation and then afterwards.
Without the various bits of infrastructure, the support teams, whether it be nurses, physiotherapists, secretarial staff, ward staff, everyone through to the caterers, that's a team approach, and any bit of it that falls down will have a detrimental effect on the overall procedure. So what I think is nice about the Nuffield is that really we do excel in all of those different areas.
I think the patients, when they come first time with an ailment, they're very stressed, they're anxious, and all this, I think, puts a lot of problems in their mind, how they're going to recover, what the problems could be after care, and etc. So apart from the medical things, if you also highlight those things, how we look after them, it makes, I think, a great difference in the recovery from their whatever the medical problems they are coming to. So the personalized care, in my view, is very important.
Not only does it mean that you have the opportunity to get on with your job without having to worry that there are various other elements that may not be sort of pulling in the same sort of direction, but it means that if you come across challenges and difficulties, which inevitably you always will, you can rely on the fact that you've got colleagues who are willing to go the extra mile to pick up the slack. If there's an area of expertise where you feel you're not capable of delivering a service to the expectations that we would all like, then you can rely on a friendly face or a colleague to step in and give you a hand when you need it.